Have some big news coming in. 10 new cases come to light in the state today. Total number of positive cases in Karnataka rises to 74. 3 people have died and 5 people have been discharged so far. 5 new cases have come to light in Chikkaballapur alone, that which we've been talking to you about. 2 new cases have been reported from Bengaluru city. So the number of cases is only on the rise. We're talking about how 10 new cases have come to light in the state today, taking the total number of positive cases in Karnataka to 74. 3 people have lost their lives due to COVID-19, and up until now, 5 people have been cured and discharged. And in the latest, we have 5 new cases being reported from Chikkaballapur alone out of these 10 new cases. And 2 of them out of the 10 have been reported from Bengaluru. So that's where things stand when it comes to COVID-19 in Karnataka. These are the numbers that we are flashing for you on our screens. 10 new cases have come to light in the state. Total number of positive cases in the state rises to 74. 3 people have died and 5 people have been discharged. 5 new cases have come to light from Chikkaballapur alone, and 2 new cases have been reported from Bengaluru city. Well, it is indeed a tall task for the health officials and the government authorities on ground to ensure that these numbers do not spiral anymore. At this point in time, we're sitting at 74 cases in the state. For more on this, I'm being joined in by my colleague Prajwal live from the newsroom. Prajwal, the number of positive cases has only skyrocketed in the state. 10 more cases coming to light, taking the tally to 74, out of which 5 of them are from Chikkaballapur alone. What more do you have for us on this?
Absolutely. Now, because Adarsh, one important thing that we need to clearly go on and understand is the fact that there has been a spike in the number of cases that we are seeing mainly from Dakshina Kannada as well as Chikkaballapur too. Because out of the 10 cases that has been reported from the previous day, from 64 cases that we had, now it has gone up to 74 cases, and this was the medical bulletin that was released, the midday medical bulletin that was released by the government of Karnataka, by the Department of Health and Family Welfare too. And till 8 a.m. they had given from the 27th from 5 p.m. till the morning of 8 a.m. on the 28th. They have given the numbers now. So a total of 5 patients from Chikkaballapur, 2 from Bengaluru, and 3 from Uttara Kannada. So this is definitely quite, this is definitely quite something which everybody will have to worry about, because somewhere the DCs of both Chikkaballapur as well as Chikmagaluru were also thinking or mulling about an emergency or a complete lockdown of these 2 districts. And on the backdrop of that, this particular bulletin coming in poses a lot of threats for the people there. And also, if you look at it, if you look at what happened in Chikkaballapur, that is something which will worry everybody, because from what we understand, patient number 69, who is a 23-year-old male who is a resident of Hindupur, Andhra Pradesh, and he's also a contact of patient number 19 now. So patient number 19 was also from Chikkaballapur, and he's a contact of that patient. And a 32-year-old female again who's tested positive from Chikkaballapur is also a contact of patient number 19. A 38-year-old male who is also a resident of Chikkaballapur is again a contact of patient number 19. And now it is also being learned that this 18-year-old male who is patient number 73 is also a resident of Hindupur in Andhra Pradesh, and he is also a contact of patient number 19. So this all clearly shows that all the 5 cases from Chikkaballapur which has come so far from Hindupur in Andhra Pradesh, it is now being learned that all of them were contacts of patient number 19, meaning to say that it is spreading rapidly, and somehow these patients who had been tested positive initially had something to do with this. And this is definitely quite a scary situation in Chikkaballapur, and therefore even the medical education minister, to whom the constituency itself belongs to, is also quite alert on this entire scenario, and even he seems to be worried about this entire situation. But somewhere the Karnataka Health Department over here is saying that all is well, and we will make sure that everything will be set in order too, and they have also denied reports of community transmission. But on the other other hand, Deputy Chief Minister of Karnataka, Govind Karjol, has a different narrative here. He says that community transmission has already been reported and the Indian authorities themselves have reported it. So if the Indian authorities have reported it, if Deputy Chief Minister Govind Karjol is saying it, whom do we believe and whom do we not believe, and why is there this sort of confusion that is coming in? Because there has been no sort of official confirmation that has come in from either of those people who are handling the task force, because there are 4 people who are handling the task force: Baswaraj Bommai, Sudhakar, Sri Ramalu, as well as Ashwath Narayan too. So none of these people who are handling the task force have given any sort of official statement, but the Deputy Chief Minister of Karnataka has a different narrative over here. And 3 people now coming in from, 3 people testing positive coming in from Uttara Karnataka, 2 shows no sort of connection with the previous cases too, but somehow when the contact tracing was done, they are still stating that it is still underway too. So a medical bulletin will be there at 6 p.m. today, and the Honorable Medical Education Minister Sudhakar will be addressing it. So between that time, how many more cases will Karnataka be seeing in? We still do not know, because this is still a midday update that has come in so far, and it itself has gone ahead and showed 10 cases of increase of 10 cases so far. So we are looking at a percentage of anywhere between 1% to 1.7% going ahead, and the exponential curve is only rising, because if you look at from the past few days, from 51 cases it became 55 cases. From 55 cases it was we saw an increase of 9 cases on Thursday. It became 64 cases, and after that today we are seeing an increase of 10 cases. So it clearly goes ahead and shows that it is only increasing, because something which had to be worried was between Tuesday and Thursday, because what happened between Tuesday and Thursday was the fact that there was an increase from 43 cases to 51 cases. So an increase of 8 cases was seen over here. But after an increase of 8 cases was seen, somehow owing to the lockdown, we also saw that it decreased drastically by 50%, and only an increase of 4% was seen between Thursday to Friday. But after that it has again skyrocketed now, and somewhere now looking at it, on Friday we saw 9 cases, and on Saturday only till the midday we have seen 10 cases. So definitely the Karnataka government is still it is still going ahead and struggling to see what is the epicenter, because at every point of time for each state across India it will be very important to determine as to which is the epicenter. And for now, more number of cases being reported from Bengaluru, 42 cases being reported from Bengaluru in itself is a huge task for them. But the most affected state in terms of intensity as well as the critical care unit cases that we are speaking about, both Kalaburgi as well as Chikkaballapur. There's a view over there. Bengaluru 41 cases, Kalaburgi 3, Kodagu 1, and total number of deaths, Kalaburgi 1, and total cured is 5. In Bengaluru we can easily state that 1 death had been reported, but this had to do with Chikkaballapur. The person, the lady who had come in from Chikkaballapur was being treated at the Rajiv Gandhi Institute of Chest Diseases, so it will have to be attributed to Bengaluru where she died, but the root cause will be Chikkaballapur. So in Chikkaballapur, if you look at it, total number of cases is 8. The number of deaths which has been reported is 1, that of the 70-year-old lady who had gone to Mecca, who had a travel history to Mecca, patient number 7. And Mysuru, there has been 3 cases which has been reported, and 1 suspected case of a community transmission over here, a patient aged 34 years, 1 in Dharwad. If you could just go to the next slide now, we will also be able to take a look at it. So Dakshina Kannada reporting 7 cases over here, Uttara Kannada 6 cases, as well as Davangere 2 cases. So Uttara Kannada is something which we will have to be worried about, because in the past few days we have seen only 3 cases, but today alone we have seen 3 more cases which has come up in Uttara Kannada, meaning to say that we have seen an increase by over 100% over here. It has doubled its tally just in a matter of 7 hours or 8 hours too. And Davangere 2 cases coming in, Urpi 1 case, as well as Tumkuru 1 case. But this case coming in from Tumkuru, this is where all the panic has started, because this person from Tumkuru had traveled to Delhi on the 11th of March, and he had returned back on the 14th of March, and he's also traveled by train too, and this has left a lot of people worried as to how this was. And everybody is clearly going ahead and saying that this case from Tumkuru, as well as 1 case of this 10-month-old baby. And the other case which has come in from the other case which has come in are most probably looking at community transmissions over here, and this would be something which we will have to worry about. And throwing more inlights into these three particular cases over here, Adarsh, we have some more insights coming in where experts have clearly gone ahead and pointed out a few important things. First and foremost, those who had tested positive in Karnataka, and one important thing as of now that should be pointed out will be patient number 52, a 35-year-old man from Mysuru who was working closely along with medical professionals. So this is the case in Mysuru which I was clearly saying that we have to be worried about. And 2 days ago, when we did even speak to the health commissioner, as well as when we did also speak to the commissioner and the director, they stated that you will also have to not spread any sort of rumors. But now more and more sources pointing out to patient number 52, the first case. This might be the first suspected case of community transmission in Karnataka. So this man was working as a quality assurance section of a pharma company, a major pharma company in Nanjangud, and he had no sort of travel history or contact history either. And he was in contact with many healthcare professionals. Seriously, something which we should worry about. He was in contact with many healthcare professionals. And next is patient number 56, Dakshina Kannada, the 10-month-old baby that we were speaking about. This baby was taken to a private hospital in Bengaluru, and as per protocol, after taking permission from the government of Karnataka, they had to conduct, they had to collect swab samples as well as blood samples were also taken. And just 2 days later, the private hospital, once it obtained permission, the baby was tested on 23rd of March, and on the 26th of March, the results came in and stated that the baby had tested positive. And as of now, coming to this particular baby, the family members or the primary contacts of whom were traced have been kept in a quarantine now. So basically, they would be category B over here, potentially category B. And coming to patient number 60, who passed away yesterday on Friday, on the 27th of March, the 65-year-old man from Tumkuru had no travel history, no contact history or anything of this, and he was also tested positive. So there is a huge map to this as to whom they have met, and this will turn out to spell doom if they do not go ahead and trace the contacts as soon as possible in Karnataka, Adarsh.